just for that video.
Hi everybody, how you doing? So welcome to our Truth with Teeth. This month's actually live show. I can't just believe a month has passed by. So we are here to answer any questions that you may have about your teeth. So go ahead and submit your questions, and we already have a lot of people. They have already submitted their questions through truthwithteeth.com website and our YouTube channel, their questions through our website, our implantsandgumcare.com website, Quora, Reddit, and Instagram. So multiple areas they have submitted our questions. So we are going to keep answering the questions that we already have. In addition, also, if you have any live questions, please go ahead and share with us. And we are happy to share any other information that we can to help keep your teeth for longer and keep your teeth healthy and also your body healthy as well. Go ahead, Reese. Yes.
Alrighty, yeah, let's just jump right in. First question comes from Cora. Can Alzheimer's be caused or aggravated by periodontal disease?
Fantastic. This is actually a hot topic today. In the last couple of days, there are a lot of articles, there is a lot of information on the connection between the Alzheimer's disease and the periodontal disease. You can go ahead and search Google Alzheimer's and Alzheimer's disease and periodontal disease, and there is a lot of connection. A lot of readers who are reading the scientific journal that is talking about the connection between the gum disease and the Alzheimer's disease and the periodontal disease. They are wondering how there is a connection. So the bottom line is, without going into a lot of scientific details, Alzheimer's disease, as you guys know, it is a disease caused by inflammation. Inflammation, anywhere there is inflammation, the inflammation is connected with a lot of diseases, and periodontal disease, bottom line, is a disease caused by inflammation of the gums. So that's why they are trying to link the inflammation caused by the gum disease that also is related to some kind of an inflammation caused in the brain, and the inflammation causes degeneration. The degeneration causes the Alzheimer's disease, and that's how they are linking it. And also, there is a lot of research that has been done. The periodontal disease bacteria, the bacteria or the bugs that are causing the periodontal disease, and they have been linked to some of the inflammation that is being found in the degeneration in the brain that causes the Alzheimer's disease. So the bottom line is, there is a lot of link without, again, like I said, getting into the fine details. So there is definitely an association between the periodontal disease and the Alzheimer's disease. And what we want to get out of this is, nobody wants to get Alzheimer's. That's not fun. And it is very easy for you to prevent the gum disease and not even think about why should I put myself at risk of getting Alzheimer's disease. So prevent the gum disease. How do you do that? Visit your dentist or your periodontist on a regular basis every 6 months. And if you have gum disease and you have to visit every 3 months, brush and floss regularly. Follow the recommendations, and whatever the recommendations by your periodontist or the dentist, follow them. That way you can prevent the gum disease. So that way you don't even worry about whether there is a link between gum disease or the periodontal disease and the Alzheimer's. Does that make sense, Reese?
Yeah, that makes sense. You want to just make sure you're healthy, so there's no even chance of getting Alzheimer's.
Absolutely correct. So just like I said earlier, not only it's about the gums anymore or the teeth anymore, you want to keep your mouth and your teeth and your gums healthy. That way your total body becomes healthy.
Yeah, that makes perfect sense.
Okay.
All right, let's move on. Another question from Cora. For dental implants, Should I be looking for a periodontist or a prosthodontist or an oral surgeon?
So the question is, the dental implants can be performed, or if you want to get a dental implant, should you be going to a prosthodontist or a periodontist or an oral surgeon or even a family dentist? Because anybody can be doing, or all of these people who are dentists, for example, family dentists, as you guys know, they're dentists to begin with, and prosthodontists and oral surgeons and periodontists like me, we are all basically dentists, and after we go to the basic dental schooling and we get specialized in placing dental implants. For example, I'm a periodontist, and I went to school after dental school. I went to school to become a periodontist for 3 years to get my residency program and also my advanced surgical training. In my case, I also was in England for almost over 5 years to get some surgical training in oral surgery. So I have advanced surgical training, and also I've been placing implants for the last about 25 years. So my goal is to help people with placing the implants surgically, and after the implants are being placed surgically, the patients either go to their family dentist or a prosthodontist to get those implants restored. Family dentists, sometimes they place the implants and then they restore them. Prosthodontists, they place the implants and they restore them. And a lot of times, some simple and not too complex cases can be done at a dental office by your family dentist or even your prosthodontist. But when it comes to complex cases, when you have full mouth rehabilitation, when you have completely bombed out teeth and you have complete set of upper teeth, when you need a complete set of lower teeth, or a full mouth rehab involving a complete set of upper and complete set of lower teeth, in those cases, you probably will be seeing a periodontist like me or an oral surgeon to get the surgical component done, and then after that you will go to a prosthodontist to get the restorations, or even your family dentist to do the restoration. And one of the main things that I see in my practice, a lot of times when these patients are needing these type of complex work, like we talked about, the full mouth rehab, just to give you an example, when you need 1 or 2 implants and it's not like a major surgical procedure, and a lot of times it can be done in your family dentist office or a prosthodontist office, they can give you regular numbing, and they can be done in the office, in my office, and I do that also when it involves like 1 or 2 implants. However, when it involves multiple teeth extractions or placing multiple implants, and patients are very afraid, and a lot of these people, they've not gone to the dentist for a long time, and they're very afraid of even stepping into the dental office. So you have seen many of our patients, and they are very afraid when they come to our office, and our goal is to make them comfortable. So even when you establish a great trust with them, and even when they are comfortable, after we talk to them to proceed with the work, and they're still kind of paranoid and anxious about getting the procedure done. So as specialists, as periodontists and oral surgeons, we are specially trained in putting patients to sleep. We call it either IV sedation, or we call it general anesthesia or deep sedation. So we have the ability to put those patients into sleep, so that sometimes cannot be offered in a safer manner in a family dental office or a prosthodontic office. There are some dentists who do offer the sedation, and prosthodontists, but mainly the periodontists and the oral surgeons, the sedation is done on a very regular basis. So these complex cases can be done performed very easily in those surgical offices. So the bottom line is, if you have a dentist, go see your dentist, and then talk to them about your options for restoring a teeth using dental implants. If your dentist is able to do that, then that's great. If your prosthodontist is able to do that, that's great. Or talk to them, hey, is it a simple enough case that you feel comfortable doing, and they are able to do it? Or if not, they will be working with a periodontist like myself or another oral surgery colleague, and they will be happy to work. And bottom line, it's a teamwork. So we will be happy to more than help you. Okay, thank you.
Yeah, sounds like if you have special case or special issues, go to a specialist.
Fantastic. Yes, sir.
All right, let's do one from Reddit now. How often do dental problems lead to larger health issues in people?
Great question. So it goes back to the first question that we talked about. You know, the hot topic in the news right now is can periodontal disease, or how the periodontal disease leads into Alzheimer's disease, right? So do you think Alzheimer's disease is a larger health problem?
Absolutely.
Absolutely, right? So about half of the US adults have some kind of a major health issues. Either it is Alzheimer's, or heart problems, or lung problems, or any disease you can think of, pancreas, and brain disease, and whatever you can think of. So normally this is what I tell my patients, anytime you have infection in the mouth, so you are thinking, well, you got infection in the mouth, no big deal. But that used to be the case, and we used to not emphasize so much on the importance of how the dental disease or the gum disease affects the rest of the body. But we realize now, just like with the topic we talked about earlier, how the periodontal disease affects your brain and causes Alzheimer's disease. So anytime you have infection in the mouth, the infection just gets right into your carotid and goes into the rest of your body, into your heart, and then pumped into the rest of the body. And you can get heart disease or lung disease, stomach disease, or pancreatic disease, or diabetes, or high blood pressure, or stroke, multiple problems you can get. And it just bottom line, it's imagine you go to a restaurant and you ate some food which was infected or kind of poisonous. Now you ate it, and then your whole body gets poisoned and you feel sick, although you just ate just one portion of food. So imagine the same thing, the poison from the bacteria, the poison from all these problems that you have, the gum disease, that's getting into your system, and it's kind of a slow poison. It just keeps poisoning your body on a regular basis. Although you may not feel the effect of it immediately, at some point you are going to see the effects of it. And I can tell you a story. And you have seen one of the doctors that we are treating. Actually, he's a neurologist who we treated about 4 or 6 weeks ago. He had really infected teeth in the bottom right side. He's a neurologist. He has a very busy life, very busy practice, and he also has diabetes. And whenever he was sent to my practice by his family dentist, and the family dentist did not feel comfortable doing the extraction because he had uncontrolled diabetes. And when the neurologist comes to my practice and he shares with me, hey doc, as you know, life is busy, I'm doing everything I can to control my diabetes. Unfortunately, as you know, stress, I just cannot control, and I'm exercising and I'm dieting and all of that. And as you know, I'm a physician myself, and I completely understand, and I talk to my patients all the time, but stress is something that I can't control. I think it is because of the stress, and I have diabetes, and it's not in control. My HbA1c is a little bit higher, so what do we need to do? So we talked to his physician to get some consultation, whether and how we can manage the case. And then we've talked to the physician, we got everything, we got close to where a safer level we can go do the procedure. And then we finally got the procedure done, the 2 infected teeth out, and we got some bone grafting done to prep him for future implants and everything. And then 3 weeks later, he comes to my office for a follow-up, and then this is the comment that he made. Doc, I just cannot believe my blood sugar came all the way down. Do you think there is a relation between gum disease and my diabetes? And I'm just telling him, Doc, and I'm glad you realized that, and maybe I should take a video of what you just told me. That way I can go explain to all my patients and a doctor telling me like how the diabetes comes under control as soon as you get the gum disease under control. So this is the true story. So anytime you have a problem, and I always talk to my patients, if you have high blood pressure and if you have gum disease, and you may not need that high of a dose of a high blood pressure medication. If you have diabetes, and then if you are taking diabetes medications, you may not be needing that high of a dose of a diabetic medication when you get your gum disease under control. So you don't want to have the gum disease lead into larger health problems like heart disease, diabetes, Alzheimer's. You don't even want to think about these in your life, and if you want to do that, then if you want to lead a healthy lifestyle and you don't want to even think about these larger health problems, get your teeth checked. Go to your dentist on a regular basis. I get my teeth cleaned every 6 weeks, so get your teeth cleaned at least every 3 months. Even if you have healthy teeth, it does not hurt to get cleanings done on a frequent basis. Get your teeth cleaned every 3 months. Go to your dentist, brush and floss your teeth, and whatever oral hygiene tools that you can think of. Walk down the aisle at your departmental store and pick up a bunch of tools and pick the ones that you like and keep your mouth healthy. That way you don't have to worry about these larger health problems. Does that make sense, Reese?
That makes perfect sense.
Fantastic. Thank you.
Yeah, if you want to be healthy, keep your mouth healthy. All right. Let's do another one from Cora now. All dentists in the U.S. tell me I need to replace my dental crowns that were done overseas ASAP, or I will end up losing all my teeth. However, the best dentists I know overseas tell me that it is perfectly fine. Who do I believe?
Great question. This is one of the common problems that we see in the United States, and we have a multi-ethnic and multicultural country that we live in, and I see Texas is big, and we see people from all ethnicity. I see people from Mexico or any type of Hispanic countries, and I see people from South America. I see people from India, Asia, or any other countries that you can think, African countries, and you can think of. So the challenge with some of the developing countries, and I did all my education from India. I got no problem in saying I came from a developing country, and we had great education. We got great support. We got some great teachers, and I got no problem in saying that. And as you know, it's a developing country, and sometimes in some of these developing countries, there is not much of a standardization in the technique. And you may be a great dentist that you're practicing, and sometimes the support system that you have, the lab that needs to make the crown, they may not be doing a standard or the industry standard type of crown the patient is going to need. So although you may be a great doctor, if you're not working with a great lab, or the lab is not up to the standard of the quality that is compared to the international standard, so sometimes you may not get the best type of dental work. And I'm not generalizing that not all the labs don't do good work, and sometimes you may be in an area that you don't have access to those great labs. And the gentleman who's talking about this right here, getting the dental work done, I don't know where exactly it was done overseas, and I can't tell you which part of overseas, whether it is a metropolitan area, whether it is a rural area. So if we cannot standardize, so problems that we see here is the quality of the work that was done by the lab that may be substandard and may not be comparable to the standard of care that we see here. And the reason we say that you need to change the crowns is because we compare that to the standard that we see over in the United States, and we have some standards that has been set by the dental schools, and also we do have some state standards that are set by the dental boards, American Dental Association, or in our case, I practice in Texas, and the standards set by the Texas State Board of Dental Examiners. So every state has their own rule set what is the standard of care should be. So when those standards are set by the government or by the government officials, and we have some guidelines that we follow which are not typical for the developing countries, and there are some substandard or subpar work that has been done, and that's why we say that sometimes we see these crowns and they need to be changed, just in the best interest of you. Not that those crowns are not going to break in the overnight. For example, I have crowns in my mouth. Some of the damage has been done pre-dental school. I have some crowns in my mouth, and these crowns have been lasting for the last about 25 years. I got no problem. And some of these crowns were actually done in India when I was in dental school, like I said. And one of the things that I learned after coming here, and just like I said, this was done by one of my teachers, who's a great prosthodontist, when I was in dental school, and we had to do some of the best materials that were available about 25 years ago. So guess what? The technology has changed. So now we are able to get better materials. Mm-hmm. So now recently, within the last about 10-15 years, and I have changed some of those crowns, and the crowns fit much better compared to, not that something bad was something wrong with the crown. Like I said, it was done by a great teacher of mine, and some of the best materials available at that time, but now we have replaced them. Now they even feel better, and I think I have a good feeling that these are going to last for maybe another 10, 15, 20 years, and as long as I keep my teeth clean, and they are going to last for a long period of time. So again, going back to the question this gentleman had, whether these crowns need to be replaced. So it depends on where you got them done and who's saying why it needs to be replaced, and then just ask the honest question. Hey doc, if you're going to a dentist, just ask him the honest question, hey, why do you think that needs to be replaced? And they should be able to give you an explanation, and based on the information you get, you should be able to make an informed decision, and that's the way to go for it.
Mm-hmm. Yeah. Sounds good. Alrighty, looks like we actually have a question that we got submitted live to us, and that question is, what can I do if I have bad breath?
Great. So bad breath. So the bad breath, immediately people think of going to the dentist, right? Or immediately you think, anytime you have bad breath, immediately think of a dental problem, which is not uncommon. So one of the main reasons why a bad breath happens is a non-healthy mouth. Why does your mouth become non-healthy? So it could be a variety of reasons. You can get cavities, you can get gum disease, or you may not have a good oral hygiene, and there are multiple, or you may have broken teeth, or you may be wearing a partial denture, or you may have some missing teeth. So there are multiple reasons to why you may get the bad breath. And there is not one reason. Sometimes you may have a perfectly healthy mouth and you may get some bad breath also. However, about 90% of the time, or majority of the times, the bad breath is due to poor oral health, and the poor oral health can happen for a variety of reasons. So if you have a bad breath, so first thing that you do is visit with your dentist, and ask them whether you have some of these conditions we talked about: broken teeth, gum disease, cavities, missing teeth, partial dentures, broken teeth, things like that. So after getting a healthy mouth and after treating all of those, and if you still got a problem with a bad breath, sometimes it could be a gastrointestinal problem. So you may have a gut issue that you may still have a bad breath, and it's sometimes we normally see that. And like I said, sometimes people have very healthy mouth and now they are being sent by their family dentist to have their gums evaluated. Sometimes they may still need some kind of a gum treatment that needs to be done after being treated at the family dentist. Sometimes we treat the gum disease, they still have a problem. So now we tell them, okay, so you need to go see your gastrointestinal specialist, and you need to see a GI doctor, and maybe you have gastritis, also you may have some kind of an ulcer. So anytime we see kind of an uncommon presentation like this, and when you have a healthy mouth, you kind of give the benefit of the doubt and treat them for gum disease. And if they don't get better, and I give them even recommendations, and hey, it may not fix the problem, and I'm just telling you, like, it's easy to treat your gum problems to begin with. And if the gum disease, after we treat in the gum disease, if your bad breath still does not get better, then you need to go see a GI doctor. And there could be multiple problems. Sometimes we have seen nutrition issues, and we have some vitamin deficiencies, we have some GI issues, and we have some blood disorders, and multiple things that we find. And if you cannot find the problems with your dentist, then maybe talk to a physician whether you have a problem with the bad breath also. Yeah.
So if you have bad breath, start at the source.
Yes, sir. You got it. Okay.
All right. Let's move on to our next question. Thank you, Saeed, for that next question. Oh, all right. Let's see. Next question. Let's do another Reddit one. Dentists, what change to dental hygiene routines would have the most impact on preventing cavities?
Great question. That goes along with the question that we had earlier. What can we do for the bad breath? And some of the things that you do for the bad breath could be the same thing that you could be doing to prevent the cavities also. Bottom line, whatever that you are doing to prevent cavities or prevent gum disease or keep your mouth healthy, that all starts with the best oral hygiene routine. So the best oral hygiene routine, bottom line, is the brushing and the flossing. Those are the two main areas that you have to really focus on. So the common problem with the brushing, not that people don't brush. Most people brush their teeth. The common problem that we have is most of the Americans, there are several studies that's been done, most of the Americans brush for an average of about 15 seconds or less.
Wow.
That's right.
That's way too short.
That's absolutely right. So that's the major problem that we have. So most of the Americans brushing about 15 seconds or less, and you can't even imagine how the quality of the job by just brushing your teeth for 15 seconds. So what you need to do is you need to brush for an average of at least 2 minutes. Mm-hmm. And a lot of these toothbrushes that you see in the market, the electric toothbrush, for example, the Sonicare or the Oral-B toothbrushes, and some of them even have these smart apps that you can put on your phone to how long you brush your teeth, and it's just kind of like like a Weight Watchers or like the Samsung Health app or the iPhone Health app that you may have on your phone that watches your oral health. So the oral health app that you can have as well. So the bottom line, you need to brush your teeth for 2 minutes. In my case, I use a Sonicare, and I have my kids that use a Sonicare also. But I have, for my kids, for example, sometime when they don't use a Sonicare, when they are in their bathroom or when they're in the other bathrooms or whatever, if they're switching bathrooms, and I got timers everywhere. the sand timers. Typically, you can buy them from Amazon for like $1. So you buy them from Amazon for 99 cents, and you put those timers. That's 2 minutes. So when you start brushing, put the timer on, brush for 2 minutes, and I typically say divide the mouth into 4 quadrants. One, right side top, right side bottom, left side top, left side bottom, and then 30 seconds for each. And if you want to still kind of like get into the details, 15 seconds on the outside, 15 seconds on the inside, so kind of like 30 seconds inside outside for all 4 sides, and that's the way I recommend you do it. After you finish brushing, you have to floss your teeth, because even the best toothbrush in the world, either your Sonicare or your Oral-B or any other toothbrush that you use, it's still not going to get in between the teeth. So the teeth are like this. So in between, no matter what you do, it is not going to get in between the teeth. So you have to floss in between. And then one of the major problems that I see is anytime people floss, they kind of go in and out like that. So it doesn't work that way. So you have, if you think about it, the tooth is kind of like in a round shape, and it's in a half circle shape sometimes. So you have to go underneath, and then the tooth also, not only it's kind of like, it's not flat, it kind of curves under. So whenever you floss, you have to go under and curve under, and then it's not like in and out like this. You go like that. So in and out, not in and out. So you go curve down and then come out. You curve on the opposite side, come out. Same thing you do in between all the teeth. So these are the minimum essentials that you need to have. So in addition to the brushing and flossing, what else can you do? So you can do mouthwashes, and you can do air flosses, we call them, and we have a water pick. So there are multiple tools that are available that you can use, but those are not replacement for the brushing or the flossing. But if you want to do them on the top of your regular oral hygiene routines, which are the brushing and flossing, you're absolutely welcome to do that. And this is what I tell my patients: hey, if you believe in something, then just do it, but do it on the top of the brushing and flossing that you do. But there is no shortcut for brushing or flossing, so make sure that you got a timer. And also, when patients have periodontal disease and they have a lot of bone loss, and sometimes even the brushing and flossing is just not enough. So sometimes we give them what we call it as a proxa brush that goes in between the teeth. It's kind of like a bottle brush. When you go in between, you do it like that. Or sometimes we have what we call it as a sulcus brush. We go under the sulcus. We have rubber tip stimulators to, or sometimes when we have smokers and we want to induce some stimulation along the gum line to regenerate some of the blood vessels, and we do that with the rubber stimulators. And there are multiple tools. And so talk to your dentist when you go next time, or if you have gum disease and if you have a periodontist that you're visiting, talk to your periodontist, or your best friend is your hygienist. So you're going to be spending at least like about half an hour or 45 minutes to an hour with them when you go for your next cleaning. So talk to them about the multiple tools that you could be using to help keep your teeth clean.
Mm-hmm. Yeah, there's always something you can be doing.
Yes, sir.
All right. Let's do another question from Reddit. How good is rinsing your mouth with salt water?
Great question. So this is kind of like the mama's remedy, right? So anytime you have a problem with your mouth, you rinse it with salt water. Again, what people tend to think, okay, so can I rinse my mouth with salt water instead of flossing? No, you can't do that. So it's not a replacement for your flossing. Can you rinse your mouth with salt water, not have to brush your teeth? So it's not a replacement for your brushing. If you want to do that on the top of your brushing and flossing, you're absolutely welcome to do that. Is it a replacement for your mouthwash, the expensive mouthwash that you buy over the counter? Possible. Sometime it could be close, or at least you're going to get some kind of a replacement, or at least something close to. You don't have to buy the expensive mouthwash, and you can use the salt water. but as long as you're using your toothbrushing and the flossing. So you can try and do that. And then a lot of times patients after oral surgical procedures, when they come to our office and they say like they want to use their the salt water mouthwashes to help them heal better. So absolutely. So we dispense. We ask them to use the salt water mouthwashes in addition to the antibiotic mouthwashes that we dispense, and it does offer some help. So the bottom line is salt water does not hurt, but it is not a replacement for your toothbrushing or the flossing.
Mm-hmm. Yeah, it doesn't taste as good as those expensive mouthwashes either.
That's exactly right. Right, correct. Yes, sir.
All right, let's do a question from our website now. Who is more susceptible to oral health problems, men or women?
Great questions. I'm not biased, guys, but I'm going to tell you the truth. Okay. Probably most people guessed by now. So it's men are more susceptible for health problems, oral health problems, I should say, than women. It's not because of anything else other than and no big reason. Like you guys, like you might have guessed, men, they don't take care of themselves. Men don't go to the dentist as often they should. And even to my office, a lot of the appointments for men are made by the women, and a lot of men are brought to our office by the women. And as you know, women take care of men, and thanks to my wife and wonderful family who are taking care of me. So bottom line is, men have more oral health problems than women. However, having said that, as long as you keep your routine of doing your oral hygiene, like brushing and flossing and going to the dentist on a regular basis, you are not at more risk than women, right? So that is no problem at all. So don't think because you are a man now you have the excuse that you have more health problem. So that's not the reason why I'm saying. So the reason that we want you to know, men have more problem because they don't go to the doctor as more often. They don't take care of themselves as they should. So as long as you take care of yourself, and you are no different than a woman, and you don't have any other higher risk just because you are a man. So hope that answers the question for this reader right here.
All right, let's go back to Cora for another question. I drink a lot of liquid and I don't consume alcohol, yet I sometimes wake up with a dehydrated tongue. What could be causing this? Whom should I see now?
So the dehydration, just like this person is talking about, so you drink a lot of water, you still got, so drink a lot of, what is the question right here? Okay.
Right at the bottom, sir.
Oh, okay. So I drink a lot of liquid and then I don't consume alcohol. Okay. So what about smoking? So you may be smoking, and if you don't drink alcohol, and you may have dry mouth just from the smoking, and you may be taking some medication. I don't know about this person's health, so they may be taking some medications that is causing the dry mouth, or they may have some other medical issues, for example, like some salivary gland issues, or you may have some multiple other medical conditions. They cause dehydration that causes dry mouth. So there are multiple medications. So not just water. Don't think that you're drinking enough water and you're still dehydrated. There are multiple medical problems that could be causing the dehydration. And just reading this question, if this reader is particularly referring to having some kind of a dehydration causing some kind of a dry mouth, and that's what made him think that I should be talking to the dentist. There are multiple conditions that could be causing a dry mouth, which is related to the dehydration, and which could also be related to medications, or it could be the salivary gland problems that we talked about, or multiple other health issues, including radiation and cancer therapy, and all of that could be causing dry mouth and dehydration also.
Okay, yeah. All right. So let's go to another core question. Let's see. How many dental implants can be placed next to each other? Is 4 too many?
So, how many dental implants can be placed next to each other? Is 4 too many? 4 is not too many at all. So 4 is the minimum number of implants. Sometimes we need to replace the full set of teeth. Or I shouldn't say minimum, because sometimes we place 2 implants and then we still give them a complete set of dentures. So 4 is the minimum that you need if you need a complete set of teeth. However, can 4 be placed adjacent to each other? So depending on the condition of the jawbone, condition of the person, can you replace? And this is one of the common questions that I have. People ask me, "Hey doc, I have the money. Can I replace every single one of my teeth?" People have 28 teeth. So can I replace every single one of my teeth with dental implants? Can I have 14 implants on the top? Can I have 14 implants on the bottom? Yes, you can if you want to, but is it really necessary? You probably don't need that. So that is a question that you have. If you have 4 missing teeth, sometimes these 4 missing teeth can be replaced, sometimes just with the 2 implants, or ideally you may need 3 implants to replace the 4 teeth. If it is sometime in the front, you can manage replacing 4 teeth with just the 2 implants. If it is in the back, you may want to think about replacing them with the 3 implants. It really depends on the condition. Sometimes you got like a 6 foot tall person. Can you replace 4 teeth with 2 implants? Possible, but he may be at a higher risk of losing the implants because of the the pressure and they are putting in and the biting force they are putting in. Can you treat a petite woman with replacing 4 teeth with 2 implants? You can possibly do that. So it depends on the condition. However, to answer this person's question, can implants be placed 4 implants adjacent to each other? Yes, they can be, and also 4 implants is not too many. And we have patients who have as many as about 28 implants, and so we have we kind of sometimes joke with our patient. This patient has implant syndrome. They got mouthful of implants. So yeah, it's not too many. Yeah.
All right. Bottom line though, if you need some implants, come here. We'll give you as many as you want.
Yes, sir.
All right. So let's go to another question from Cora. What is the reason that some people have 32 teeth while some have just 28? How late can the wisdom teeth come out?
So why do people have 32 teeth and why somebody have less than 32 teeth? So sometime it could be 28, sometime it could be 30, or sometime it could be as low as maybe even none. So we have some medical conditions and the permanent teeth never come through. So can you have 28 teeth if you don't get your wisdom teeth? Yes, you can have 28 teeth. And how late the wisdom teeth can come in? The wisdom teeth, usually the eruption age is anywhere between about 14 to 17. 14 years is like when you start to see them kind of developing under the jawbone. About 16 to 17 or sometime around that age is when you're starting to have them come through your mouth. So if you don't see them, not that you may be missing, you will need to go to your dentist to have them check it out. Even when you're older than 17, you may not know that you have wisdom teeth they're stuck underneath the jawbone. You cannot see, but a lot of times we are able to see it when we take what we call it as a panoramic x-ray or a CAT scan. So don't think that you have missing teeth. So talk to your dentist, and then this is exactly what we see. And a lot of times when we have adults, when they have come in, they have not gone to the dentist for a long time, and then now they come into our office thinking that, okay, so I don't have any wisdom teeth, and then now they come in and they have not gone to the dentist for a long time, and then we do a CAT scan, or we call it as a CBCT scan, when they do the CAT scan, then now we are finding all of a sudden wisdom teeth, and then they're asking me, Doc, how come no one ever told me that you got wisdom teeth? And we asked them a question, when was the last time you went to the dentist? Well, maybe about 10-15 years ago. So no wonder. So if you have missing teeth, again, don't think that you don't have them. It may be hiding underneath, not just the wisdom teeth. So you may have other teeth that are missing as well. Sometimes they never come through. Sometimes we see the front two teeth on the side teeth, they never come through. And sometimes we have the eye teeth, they never come through. They may be completely hiding underneath the gum line. So the bottom line is, check with your dentist, have them do a regular x-ray or a panoramic x-ray or a CAT scan to see whether you have any missing teeth.
All right. Let's see, another question. Periodontology. How effective is periodontal graft surgery? I hear stories about people that have gotten a skin graft only to have their gum line recede again after a few months. Is the surgery worth the money/nuisance? Or is better dental hygiene enough to stop gum line recession?
Great question. So I'm going to kind of reverse the question and answer in the order which will make better sense. So is better oral hygiene or better dental hygiene just enough to stop the gum receding? Yes, definitely a good oral hygiene is important enough to stop any further gum receding. However, if you already had gum receding, it's not going to fix the problem. So just the good oral hygiene itself, it's not going to fix the problem. So to fix the existing gum receding, you need to have some kind of a gum grafting surgery done. However, after fixing your gums with the gum graft, you need to still practice good oral hygiene, otherwise you will still get the gum recession back again. So to answer this question here, so is it worth having gum surgery done? So let me ask you this question: is it worth having a tooth in your mouth? So if you answer the question, yes, it is worth to have your tooth. Particularly, a lot of times I see the gum receding in the lower front teeth, which is one of the most common areas. People have a lot of tartar buildup, which causes the gum receding. And then we have also what we call as a frenum on the inside that causes the gums to pull away from the teeth, which is one of the common reasons why I see in my office people lose their front teeth and why they need to have the gum grafting surgery done. So if you answer the question, it is critical for you to keep your front teeth or any other teeth that have gum receding, then you answered your own question. So it is necessary to have the gum grafting done. So going back to the question again, so if you thought it is worth to have the gum grafting done to keep your tooth, so then what happens and why do you get gum receding again? If you got the gum grafting done, and it is one of the reasons why you got the gum grafting or gum receding, because you never went to the dentist and you did not take care of your teeth. So then if you continue the same thing after getting the gum grafting, you don't go to the dentist, you don't visit your periodontist, you don't practice oral hygiene, then you are going to end up having the gum graft fail. So imagine you smoke and you drink, and then you don't exercise, and you have a history of heart disease in your family. Now you got a heart problem, now you had a heart attack, and then you need to have a bypass surgery done. After you fix your heart and after you had the bypass surgery done, then if you continue the same habits, smoking and drinking and not having a good lifestyle, then you're going to get another heart attack. The same problem. So with the gum disease or the gum grafting, if you already had gum grafting done for the reason that you had gum receding, and if you don't follow through with good oral hygiene, and if you don't follow through with going to the periodontist on a regular basis, yes, you are going to have those gum grafts fail. And one of the other common reasons why the gum grafts fail that I see in my practice is patients don't wear the night guard. So one of the main reasons why the gum recession happens, gum receding happens, is because they have a heavy bite force, and the teeth are clenching, or they're grinding their teeth. They're putting heavy force when they bite down on their teeth. If you wear a night guard, when the forces get distributed evenly, you don't run the risk of having the gum recession again. But if you don't, then you will end up having recession. Now, I'm just pointing out one reason. There are multiple reasons to why we call it as aggravating factors. So you need to fix the aggravating factors, or factors which cause exacerbation of those gum recession. You need to fix those factors in addition to fixing the gums, so that way you continue to have the same healthy gums.
Mm-hmm. Keep yourself healthy, keep your gums healthy.
Yes, sir.
Alrighty, just a few more questions left. Let's see if we can get them all. What are the side effects of removing healthy permanent teeth for applying braces or implants?
So, removing the healthy teeth, you don't remove any healthy teeth just for placing one implant. However, sometimes as part of a bigger treatment plan, you may end up losing some healthy teeth. So I kind of give them example in my office. If you have a lot of failing teeth, for example, like you have about 14 teeth on the top, but 10 of them completely failed, and you only have about 4 remaining, and 4 of them are really healthy. Is the 4 good enough to support the rest of the teeth, or is the 4 good enough in areas that you are able to comfortably and efficiently, effectively, economically give the patient a solution that is going to be long term? It's not possible all the time. So those teeth may be spread out in areas that you are not able to, I call it as a EEE treatment plan: effective, efficient, and economic treatment plan. So if this is not going to fit the EEE treatment plan, then you may end up removing the healthy teeth, which is not uncommon at all. Sometimes we remove as many as about 6 or 7 teeth, or as many as about 8 teeth, or maybe even more, to give them a complete and comprehensive the EEE, effective, efficient, and economical treatment plan, and healthy mouth. So that's part of the question: can you remove healthy teeth for implants? Yes, you can remove them. And can you remove healthy teeth for braces? Yes, you can. So the reason that you need to have braces is because either you don't have enough space in your jawbone, or some of the teeth are completely crooked to the degree that you cannot bring them into position unless you remove them. It's going to affect your total treatment plan of having a great smile. So you can remove them as part of the braces, and you can either for the reason to create some space, or just because of the fact that they cannot be brought into position. So either you do it for implants or braces. It's not an uncommon thing to happen.
Mm-hmm. I myself had 4 teeth removed so I could get braces. Yeah.
Absolutely, yeah. So you see in our office all the time. So that's what we do for braces, yeah.
All right, next question. Do we need to treat congenitally missing teeth?
So great question. So we talked about that. We talked about the same topic in one of the previous questions, and the question was about what is the reason people have 32 teeth and some only have 28. So I said not necessarily 28. People have even less teeth than 28, and during that time we talked about the 2 missing teeth may happen even in the front. So the congenitally missing teeth, depending on where those missing teeth are. So if you have the congenitally missing teeth in the front, you don't want to be walking around with no teeth in the front, do you? Well, you answered your own question, so you definitely need to be replacing them. Not necessarily, I don't know whether this person is asking whether they need to replace them with dental implants. There are multiple options available to replace missing teeth. You can have dental implants, or a partial denture, or a Maryland bridge, or a fixed partial denture. There are multiple options available. And back teeth, so whether you are able to function normally, as also that depends. So if you have congenitally missing teeth and if you're not able to function, if you're not able to chew your food properly, so you need to have those teeth replaced, either in the back, one side, or both sides, whichever side you may have missing teeth. And also not just the chewing function, but also as you age, your face is going to sink. So if you have a lot of missing teeth, congenitally missing teeth, you may not worry about the function, about eating or chewing, but you don't want your face to start sinking as you get older. So you may want to just replace those teeth. For that reason, you want to keep looking young, and who don't want to be looking young all the time, right? So you definitely want to you want to consider replacing your teeth for a variety of reasons, including keeping yourself healthy and keeping yourself young and beautiful, and have a healthy smile and being able to chew and all of that. So congenital missing teeth definitely need to be replaced depending on what your goals are. Yeah.
All right, let's get to our last question. How do you treat swollen gums around molars?
So how do you treat the swollen gums around molars? The swollen gums around the molars could happen for a variety of reasons, and I'm not sure whether this person is specifically referring to the swollen gums around the back molars, which is not an uncommon thing to happen around the wisdom tooth. So if it is related to the wisdom tooth, my recommendation usually is to remove the wisdom tooth and be done with it. Not for the reason that you have problems with the wisdom tooth in the back, it's to prevent problems to the tooth in the front. If you leave the swollen gums in the back of the third molar around the wisdom tooth, you may not be able to keep it clean, you may not be able to access properly, you will get cavities around them. When you get cavities around them, then the cavity is going to spread to the tooth next door. If you get gum disease around them, then your gum disease is going to spread to the tooth next door. So why bother? Get them out of the way and be done with it. In our office, the usual recommendation is when you're young and healthy, we normally recommend getting all 4 wisdom teeth removed at the same time and be done with them. And if you have swollen gums around the back molars and the other molars, the second or the first molars, or even the premolars, that could be related to either a gum problem, or it could be a root canal problem, or it could be as simple as something stuck onto your teeth, or it could be some kind of an infection going on. So there could be a variety of reasons why you could be having some swollen gums around the back molars. So the best thing is, and if you have not seen a dentist, and if that is what is causing the problem and the swelling that you're talking about, go visit with a dentist, and your dentist should be able to easily look at it just by looking at it, or by getting some x-rays done. So they should be able to give you an answer. Again, it could be a more serious problem than what you can think of, so make sure that you're going to visit with your dentist, and they can definitely help you.
All right, looks like that does it for us tonight.
Well, thank you so much, guys, and thank you for joining us for the Truth with Teeth show. And I want to thank you, Reese, and I want to thank you for all the watchers, and thanks to all the people who have been submitting their questions via Reddit and our website truthwithteeth.com and the implantsgumcare.com and Quora and other websites. So keep submitting your questions, and as you guys know, we do this show once a month, and we will be announcing our next show within the next few days. We will be announcing the show. So we look forward to seeing you all again, and thank you again for watching. Until next time, bye.
See you in February.